Welcome to the Informed Woman magazine, where science meets clarity and knowledge becomes strength. I'm William Bologna. Let's make women's health understandable together.
Every month, millions of women wait, hoping this will be the month. But for 1 in 8 couples, conception doesn't come easily. Today we begin with the science of infertility, its hidden causes, and the delicate systems that shape new life. Infertility is defined by the American College of Obstetricians and Gynecologists as the inability to become pregnant after 1 year of unprotected intercourse for women under 35, or after 6 months for those over 35. It's far more common than most people realize, yet rarely discussed with clarity or compassion. Infertility can arise from many causes: hormonal, structural, and physiological. The female body is a masterpiece of timing, chemistry, and design. But when even one link in the chain falters, conception may become impossible. Hormonal imbalance is one of the most common culprits. Conditions like polycystic ovary syndrome, PCOS, can disrupt ovulation by flooding the system with excess androgens. Thyroid disorders, whether hypo or hyperactive, can also silence ovulation and disturb the menstrual rhythm. Sometimes the barrier isn't hormonal, but physical. Blocked or damaged fallopian tubes, often the result of endometriosis, pelvic inflammatory disease, or surgery, can prevent the egg and sperm from ever meeting. Even when fertilization occurs, uterine fibroids or polyps can prevent implantation or cause miscarriage. Age remains one of the most powerful factors. A woman is born with all the eggs she'll ever have. By 35, both quantity and quality begin to decline sharply, raising the risk of miscarriage and chromosomal anomalies. Time, though invisible, leaves fingerprints on fertility. Lifestyle choices can quietly influence reproductive health. Obesity, smoking, excessive alcohol, and chronic stress each disturb hormonal balance. When the body feels threatened, it prioritizes survival, not reproduction. Some cases trace back to genetics or autoimmune disorders. The immune system, designed to protect, sometimes turns on the body's own reproductive cells, disrupting ovulation or embryo implantation. Roughly 1 in 3 cases of female infertility involves the fallopian tubes. These narrow passages, almost as thin as a human hair, can easily become scarred or blocked. Endometriosis, infection, or prior surgery can leave behind invisible damage, preventing fertilization or leading to ectopic pregnancy. Even mild endometriosis can affect fertility. The uterus relies on gentle wave-like contractions to guide sperm toward the fallopian tubes. In endometriosis, these contractions become erratic, a phenomenon called uterine dysperistalsis, hindering sperm transport and embryo implantation while also causing pain. In PCOS, high insulin levels stimulate excess androgen production, halting ovulation. The result is irregular or absent menstrual cycles, and the formation of multiple immature follicles. Over time, this imbalance can also thicken the uterine lining, reducing receptivity even if fertilization occurs. Because infertility has many causes, finding the right treatment begins with accurate diagnosis. Hormone testing, imaging, and lifestyle analysis reveal what's hidden beneath the surface, opening the door to targeted therapies and renewed hope. Every mystery begins with a cause, and every cause deserves an answer. Now that we understand why conception can be difficult, how do doctors uncover the precise reason? In our next episode, we'll move from understanding the problem to discovering the diagnosis, the first step toward healing and conception.
Not every journey to parenthood begins in a laboratory. For many couples, simpler, less invasive options can help nature find its rhythm again. Today, we'll explore non-IVF treatments that give the body a helping hand and reveal the crucial role male fertility plays in conception. Non-IVF fertility care includes lifestyle changes, medications that stimulate ovulation, intrauterine insemination, or IUI, and restorative reproductive methods. These approaches are less invasive and more affordable than IVF, though success depends on the underlying cause of infertility. Ovulation induction helps the ovaries produce and release mature eggs, vital for women who rarely or never ovulate due to conditions like PCOS or hypothalamic amenorrhea. The process uses medications that mimic or regulate natural hormones. Clomiphene citrate, often called Clomid, blocks estrogen receptors in the brain, prompting the pituitary to release more FSH and LH. These hormones stimulate follicle growth and trigger ovulation. Aromatase inhibitors like letrozole reduce estrogen production, achieving a similar effect. If these oral medications don't succeed, injectable gonadotropins containing FSH, or FSH plus LH, can directly activate the ovaries. Throughout ovulation induction, close monitoring with ultrasound and blood work ensures the ovaries respond safely. This careful balance helps prevent ovarian hyperstimulation syndrome and optimizes timing for conception. Ovulation induction is often paired with timed intercourse or intrauterine insemination to increase success. The goal is precision, aligning ovulation and fertilization within the body's natural rhythm. In IUI, a concentrated sample of healthy motile sperm from a partner or donor is placed directly into the uterus near ovulation. This simple, minimally invasive procedure bypasses the cervix and brings sperm closer to the fallopian tubes, where fertilization naturally occurs. Before insemination, the sperm sample is processed to isolate the strongest swimmers. The procedure takes only minutes, followed by brief rest and a 2-week wait to learn if conception occurred. IUI benefits couples with unexplained infertility, mild male factor issues, or cervical mucus problems. It's often the first step before IVF, offering a balance of accessibility, affordability, and measurable success. Male infertility contributes to nearly half of all cases worldwide. Low sperm count, poor motility, abnormal shape, or blockages can all interfere with conception. Conditions like varicocele, infection, genetic abnormalities, or toxin exposure often play a role. Diagnosis typically begins with semen analysis to assess sperm count, motility, and shape, followed by hormone testing and genetic screening. If needed, imaging studies reveal structural blockages or testicular abnormalities. Treatment depends on the cause. Hormone therapy can restore testosterone and FSH levels, stimulating sperm production. Surgical repair of varicocele can improve blood flow and semen quality. Lifestyle changes, quitting smoking, reducing alcohol, maintaining healthy weight, make a measurable difference. For complex cases, assisted reproductive technologies step in. In ICSI, intracytoplasmic sperm injection, a single healthy sperm is injected directly into an egg during IVF. If sperm are absent in the ejaculate, procedures like TIASI or PISA retrieve viable cells directly from the testes or epididymis. From hormonal balance to precise laboratory technique, non-IVF treatments have helped countless families conceive. But when these steps aren't enough, science offers one final frontier: in vitro fertilization. In our next episode, we'll enter the world of IVF and advanced genetic testing, where technology, timing, and the human spirit come together to create life.
Sometimes, when nature needs a little help, science steps in. This is the story of how in vitro fertilization and the innovations that followed have reshaped what's possible for millions around the world. IVF, in vitro fertilization, is an assisted reproductive technology that brings egg and sperm together outside the body. Through a series of carefully timed steps, life is given a new opportunity to begin. The IVF journey begins with ovarian stimulation. Fertility medications, often containing follicle-stimulating hormone, encourage the ovaries to produce multiple eggs instead of just one. Frequent ultrasounds and blood tests help ensure that the timing for egg retrieval is precise. When the eggs are ready, a brief procedure called egg retrieval is performed under light sedation. A fine needle is guided through the vaginal wall to gently collect the eggs from the ovarian follicles. Each egg represents a possibility, a single spark of life waiting for connection. At the same time, a sperm sample from the partner or a donor is processed and concentrated to select the healthiest, most active sperm, improving the chances of successful fertilization. In the laboratory, the retrieved eggs are combined with sperm for natural fertilization, or a single sperm is injected directly into an egg through a procedure called ICSI. This technique allows fertilization even when sperm count or motility is low. Fertilized eggs are cultured in an incubator, where they begin to divide and form embryos. Over several days, embryologists monitor their growth, selecting the healthiest for transfer or freezing. After development, one or more embryos are transferred into the uterus using a delicate catheter. Any remaining viable embryos can be cryopreserved for future use, allowing additional chances for conception. Then comes the waiting. 2 weeks of patience, hope, and courage, ending with a single test that reveals whether life has taken hold. To enhance success rates, some embryos undergo pre-implantation genetic testing, or PGT. This process screens embryos for chromosomal abnormalities and genetic disorders before implantation, reducing miscarriage risk and improving pregnancy outcomes. A newer advancement, polygenic embryo screening, looks beyond single-gene conditions to assess risks for complex adult diseases, such as heart disease, diabetes, and certain cancers. Though still evolving, it represents a significant step toward personalized reproductive medicine. In recent years, frozen embryo transfer, or FET, has revolutionized IVF. Rather than transferring embryos immediately, they are vitrified, or flash frozen, and transferred during a later, more natural cycle. This separation allows the body to recover from stimulation and prepares the uterus for optimal implantation. Studies show that frozen transfers result in higher implantation and pregnancy rates than fresh transfers. By restoring the body's hormonal balance, the uterine lining becomes more receptive to new life. Vitrification prevents ice crystals from damaging cellular structure, increasing embryo survival and minimizing the risk of ovarian hyperstimulation. It's a scientific breakthrough that combines precision with safety. Frozen embryo transfer has also encouraged safer single embryo transfers. By controlling timing and quality, fertility specialists can reduce multiple births while maintaining high success rates. It's a gentler, more precise way forward. We began with causes, moved through diagnosis, and arrived at creation itself. IVF and advanced fertility treatments are not just about science. They are about perseverance, compassion, and hope. For those who have struggled, this technology proves that the impossible can become possible. And though this series ends here, the story of life continues.
Thanks for watching another video by the Informed Woman magazine. Please feel free to comment and ask questions. Subscribe for more science-driven medical insights.